Thanks to everyone who has officially joined us for this webinar. This webinar is entitled Media Planning for Policy Change. It's put on by Delta Prep as well as Berkeley Media Studies Group. And we just want to remind you all, if you are having any trouble, any tech trouble at all, please call the number that's on your screen, which is 1-866-229-3239. That's 1-866-229-3239. And if for some reason you accidentally unclicked your call-in line, you can go to the top of your browser and you can go to the Communicate tab and click on Join Teleconference. And that will pop up again your number to call in to join us and receive the audio portion, which you probably wouldn't be hearing now if you were having trouble with that, but that will give you an opportunity to see that number again. So we are very happy to join you. We're going to turn we're going to pass the mic to Pam Brown, who's going to give a little bit more information about why we are here.
Thank you, Julieta, and welcome everyone. Good morning, good afternoon, depending on where you're calling in from. I'm Pam Brown. I'm the project director for Delta Prep, and just very briefly, many of you have participated in the Delta Prep project. Some of you are Delta coalitions, and some of you are colleagues in coalitions from other non-funded Delta or Delta Prep states around the country, and we're just delighted to have you all on this call. One of the things that has been a goal of Delta Prep was not only to work with the grantees to build their organizational capacity for primary prevention of intimate partner violence, but also to help contribute to a national conversation among all of us, all DV coalitions and other stakeholders, to promote IPV primary prevention and to create opportunities for leadership by domestic violence coalitions to raise awareness around IPV and preventing it. So conversations like our webinar today really help us to move towards that goal, and we're delighted to have so many of you joining the conversation. The Delta Prep coalitions are 19 coalitions, and as part of our activities this past year, we conducted a national survey, and many of you helped fill it out around the country to find out what kinds of information was helpful to you. And one of the things that was highlighted very strongly in our survey was an interest in how to utilize the media as a vehicle for impacting policy around prevention. So we're delighted to be partnering with Berkeley Media Studies Group today, who's been working with our project over the past year in various ways to help build that capacity among all of us to be strategic in how we take advantage of opportunities to engage media in promoting our work. And so we're delighted to have Julieta Kuznier and Lori Dorfman from Berkeley Media Studies Group, who will be conducting today's program, and we hope you will enjoy it. Thanks.
Thank you, Pam. So again, as Pam has mentioned, people can contact, we're going to actually be holding half an hour session. I don't know if Pam actually mentioned, but we're going to be holding half an hour for questions. So if anyone have any questions during our presentation, we're going to do an hour-long webinar, and then we're going to hold half an hour after that hour for people to ask questions. So please write down your questions, keep your questions that come up with you, because we will have a good amount of time to go over those questions with you. So we just wanted to talk a little bit about who we are, Berkeley Media Studies Group. Berkeley Media Studies Group breaks up into two teams. We focus on research and media monitoring and focusing on how the media portrays health issues and how that in turn impacts public perceptions and public policy. We also focus on trainings like this one, where we get to work with nonprofits, health organizations, departments of public health, working on a wide array of issues on how to use the media to push for policy change. So we also, along with that, work on the other end and work with journalists. My background personally is in radio. I'm a longtime radio producer. I have over 10 years of radio experience. So I come to this work as someone who has studied health, and I have a public health background as well, but I really come to this through the media orientation. And as someone who has spent a lot of time deciding what goes on air and what doesn't, and what things may make that more or less attractive in that specific moment, as a daily radio producer for a public affairs public broadcast. So that's personally my background. And Lori, is there anything you'd like to add about your background?
My training is in public health, and I study the news media, as Julieta said, with this express purpose of figuring out how, as public health advocates, we can become stronger voices in policy debate. So our studies of the news are designed specifically to understand what's going on so that we know what the starting point of the conversation is, particularly when that conversation is with policymakers, since they're the ones who set the rules about what's permissible and not in a real formal way in our society. So we study the news, apply it to the media advocacy training and technical assistance we do with groups, and to the professional education for journalists, as Julieta said. And I'll talk a little bit more about what we've learned from our studies of intimate partner violence and child sexual abuse a little bit later.
Thanks, Lori. So first off, just to get a sense of who is in the room, we want to do a poll with you all and get a sense of how confident and how comfortable you all feel using the media specifically to push for policy change. So in just a moment, you all will see a poll pop up on your screen. It just takes a couple clicks. So just think about it clearly, what comes up to your mind. So how confident do you feel using the media to advance your public policy goal? Very confident, somewhat confident, or not at all. So if you could just take a minute and fill in that poll. And if you could look on the right-hand side, you will see that poll question pop up. You may have to click on an arrow to maximize that window. So we're going to give folks a minute to start answering that question, and this is going to be, it's just going to pop up the responses. We're not going to see individualized replies. So please take a moment just to fill out that poll.
And if you don't see the poll or you have trouble of any kind, use your chat function to let Heather Gellert know. She's assisting us here at BMSG. She's the brains behind the technology at BMSG, helping us put the webinar on. We've only got, I think, a couple more minutes for the poll. Heather, should we wait any longer? Do we have some results?
It looks like people are finished, so I'll give it another 5 seconds just in case anybody else is going to jump in and submit an answer. Okay. Just a moment. Takes a few seconds to process this before we see the results.
In the meantime, we hope you're just excited with anticipation about all the stuff we're going to talk about in just a minute. And the time we have dedicated at the end is really going to be an exchange of ideas, not just Q&A. Definitely we want to answer as many questions as we can, but we also want to draw on the expertise and knowledge as well as questions in the group, because working out some of this media advocacy, particularly on the issue of intimate partner violence, is no easy task. It's, in fact, extraordinarily difficult. So we want to power through that together.
So we've gotten those results. I think this poll is now public and everyone can see the different bars. And as we can see, the largest bar, 49%, is in somewhat confident. People feel somewhat confident in terms of their using of the media to push for policy change. And the smallest window is under very confidence, which we find people who work around IPV, advocates around IPV, are very sophisticated when it comes to getting in the news. There's a large community that has been working for a long time to make their issue urgent and present, and that's why we have laws protecting survivors of domestic violence and all kinds of different IPV issues. What we understand that people are having what's a little bit more challenging, which Lori just touched on, is not just getting in the news, but actually having that news coverage be a vehicle to push for your specific policy goal, particularly around issues like primary prevention. So that goes to what we are hoping to cover today. We are going to spend some time talking about why the news role is so important. Why does the news media matter? We're going to spend some time talking about why using the media can help further primary prevention goals. And we're going to spend some time actually thinking about how can an organization do this from a top-down, what are the different elements that are essential to include, and what are some opportunities where people can actually think creatively and use the media in this way. All right, so we're going to now take a moment. We want people to actually just think out loud, think creatively, and open up their chat window. So on their right-hand side, there's a little icon. It's a little bar at the bottom that says chat, and it has a little talk box with two little dots inside. If you could maximize that screen, so that means clicking on the little arrow, and that opens it up. And if you could just take a moment and just think, answer the question in any way that comes to mind. What do you think you can do to create news about primary prevention of intimate partner violence that is not related to a specific incident of violence? So just to clarify, sometimes it's easier to think we hear of a crime, we hear of a report, we hear about something happening, for example, we're thinking about what's happening in Pennsylvania, and everyone is talking. Right now the attention is on child sexual assault. But how do you create news when it's not necessarily related to a specific incident? So we already have we already have a response. We're going to give folks just about 30 seconds. Just think, anything that comes to mind.
We'll address those later. We're not going to go into them right now, but we're going to use this as fodder for some discussion.
And just a reminder, folks, you can choose from the drop-down menu where to send your responses. It looks like some of them are just coming to the host privately. So Julieta and Lori are not able to see your responses. So if you can not just choose the host from the drop-down menu so that others can see your responses, that would be great. Thank you.
Choose all participants. Great, you guys. It's wonderful to see this coming up. So we'll be drawing on that as we continue in the conversation.
And I just want to highlight some of the responses we're getting related to holding events and to capitalize on Domestic Violence Awareness Month, Teen Dating Violence Awareness Month, Sexual Assault Awareness Month. These are all really creative ideas. You all have done a lot of hard thinking around how to get your issue in the news, specifically in a way that furthers your policy goals. So this is something we find is really essential and is oftentimes, it's really the most difficult thing to not just react but create. Wonderful. So I'm going to let last couple folks finish typing in their answers, and we're going to talk about why we're here today and how media advocacy is a little different from some of the health education campaigns that dominate the news. All right. So we want to really underline what we work around here at Berkeley Media Studies Group is media advocacy. And sometimes when people think about the media, they think just getting their issue and spreading awareness, creating awareness, and oftentimes media advocacy is also connected to social marketing, and it's seen as one of the same. Although we think social marketing is incredibly important, we just want to spend a little bit of time differentiating media advocacy to social marketing. So social marketing campaigns, as many of us know, are the wonderful campaigns that bring us health information and really bridge the information gap. So, for example, if there is a campaign that wants to spread education around, verbal abuse, name-calling, that's also violence. That's something that perhaps someone may not have had that information, and perhaps seeing that campaign for them turns on a light bulb and says, wow, I hadn't considered that this was also considered violence, but now that's part of my idea, and when I think of violence, that will now be something I include. For media advocacy would not necessarily take the approach of creating awareness around that issue specifically. Media advocacy would be more targeted to a specific decision maker to change laws to make it so taking the step beyond creating awareness, but actually going to create policy. So instead of specifically targeting the general audience at large to create awareness around how name-calling or verbal abuse is also something that is to take into account, what media advocacy would do is to target specifically school board members, for example, to create a policy for elementary school students to include around health education or sexual health education classes, curriculum around healthy dating. And so this would be something that wouldn't so much just blanket a community around the health message, but would actually change the environment and change policies. So it wouldn't just be a matter of who, for example, saw the sign, or if they saw one billboard, or if they saw one ad, but that they actually it was infused and transformed the curriculum. So you have thousands of kids of young people that are affected by this change, and in turn, teachers and other professionals are also on board with the message of prioritizing this specific issue. So to underline, so media advocacy takes a policy change and uses the opportunity of the media to pressure or to mobilize supporters, while social marketing is more focused on individual change, hoping that someone sees an ad and changes their behavior accordingly. Lori, would you like to jump in there?
I just want to draw one distinction between the two, because these aren't either or propositions. They can work in tandem. So, for example, you do need to have some kind of education campaign if you're going to do something in the schools to help people understand what bullying is and isn't, and that it is indeed part of a continuum of violence, as Julieta suggests, and you need to help people understand that. There needs to be a curriculum. It has to be pre-tested, and social marketing or other kinds of information campaigns, what we call brand X media on this slide, are the sorts of things that do that. But they're going to be very limited in their effect if they happen only once in a while, if they happen on the whim of a teacher who happens to think they're important, if they're not instituted in the policy of the school or the school district. So that's where media advocacy comes in. When we want to institute things as part of our culture, ultimately, we have to bring that to bear through the policy process. That might involve the school board, it might involve superintendents or principals, and the mass media component is a little different, meaning that at the brand X media side, this is kind of a consumer orientation where somebody has information that they are delivering to somebody else, and the consumer of that information is expected to take it, use it, and be healthier as a consequence. On the media advocacy side, it's a citizen orientation, where the idea is to use mass media as a mechanism for engaging people in a political process, so that you're using the mass media in this instance to help people raise their voices in sometimes very contentious debates, which is why you need training, which is why you need to plan ahead of time, which we're going to get to, and things like that. So it's the problem in public health from our perspective is that sometimes people stop short at the brand X media just trying to deliver a message as if that will do the trick by itself, without really finding ways to institute that message or focusing on ways to help people become active as citizens in the policies that we as a society determine that we need and support. And that's a key distinction here that leads us to the definition of media advocacy.
Thanks, Lori. So the media advocacy definition that we use is the strategic use of mass media to support community organizing to advance a social or public policy initiative. So this just underlines the point Lori's making, that it's that these are two, that health education or raising awareness is something that is totally separate from media advocacy. It actually is oftentimes in conjunction. For example, you have many community members that wouldn't see an issue as an urgent priority to lobby their decision makers around if it weren't for these very well-timed social marketing or awareness-raising campaigns. So it's really something that we want to underline, that both of these aspects are incredibly important, but the emphasis on changing the environment and creating a policy solution is something that is a little bit more complicated because it requires that push to mobilize and to pressure specific decision makers. And if folks have any questions around this, please write down your questions. Feel free to even use the chat window if you don't want to lose your question. We will we have about half an hour allotted to questions at the end of this, in about 40 minutes at the end of this webinar. So please feel free to hold your questions. So that leads us to basically what is our focus? How do we decide who is our target? What are we trying to change? What specific policy are we working around? Well, all these points really focus around what is our go-to guide, which for us, we refer to it as our layers of strategy. So I want folks to be able to look at what we're referring to. We're going to go through some of those points, but if people could just go to the panelist screen, and you'll see Heather Gellert's name, and Heather Gellert has a URL little link next to her host name, and this is a link that you can just click on once, and it will pull up a PDF of the layers of strategy, which is what I'm referring to right now. So you can follow along, you can print it, you can save it, you can send it to your colleagues. So the layers of strategy for us are something that really focus on what kind of message do we want to get to? What message is important to get across? And before we can think about message, we need to think about our overall strategy, which is what is our target? What do we want to see change? What's the problem solution? Why does it matter? And who has the power to make the change that we are looking for? So this breaks down to, as we were saying, our overall strategy, which then in turn is what guides and really dictates the rest of our strategies. Because we won't know what kind of media we want to access unless we really know what we want to accomplish and who our targets are. For example, you may have a school board that you know really does follow the business publications, and that may be a really effective way to target a specific school board member. You may find that a community newspaper that is very local, that is focused in a neighborhood, would be a wonderful avenue to communicate with this person. Or perhaps a call-in radio show which reaches a larger audience. You won't know what media you want to use. Unless you know what your goals are, unless you know who your target is. So for folks who are having a little bit of trouble accessing this PDF, the PDF is located with there's a little sign that says URL right next to Heather Gellert's name under the panelist column.
Yeah, and if you're not seeing my name, make sure that you have the participants panel maximized. There will be a little arrow to the left of it that you can click on to maximize that. Then you'll see my name, and to the right of my name is the URL icon.
Thanks, Heather. So you can maximize that by making it so the arrow is facing downward. And so that will make it so the whole window is visible. And you can see Heather Gellert's name. And next to her name, you have two little icons, and one of them says URL. And that's what you can click on. And if you have any trouble, please feel free to contact us here. But the summary of the layers of strategy, the different layers are really just to guide our overall strategy, which is really something we want folks to think about, because oftentimes we want to just get in the news, but that we want to remind folks that oftentimes there could be a policy goal that you could get on the national news coverage, but that may not be helpful to pass a local city council ordinance. It may not be effective to pass something at a school district level or at a state level to have national coverage. So we all have limited resources, and we want to make sure that we very much target our work so we can effectively push our policy forward and that we can actually make the difference so our decision makers hear our issue and decide to make our issue their priority. So some of the questions that we've been covering are what's the problem or issue, the solution, who has the power to make the change, who must be mobilized, and what does the target need to hear. Something we also want to underline is sometimes we hear from folks that they don't necessarily have the appropriate spokespeople or the appropriate network to engage their decision maker. And that's something that we always push people back to think to their overall strategy, because we want to make sure that these coalitions are brought in at a ground level. So sometimes when we're not sure who can speak to this issue effectively, whatever that issue may be, whether it is, for example, passing something at a school board level, we have to think who is part of our coalition in the first place. So that's just something we want to think at the onset, that we want to make sure we include people in our decision making that are going to be effective to push for policy change. So we want to make sure if anyone has any questions on this, make sure to hold your questions and write them down. We want to make sure we cover, because as we keep saying, for us, our layer strategy really are guiding principles and thinking, when do we engage media and how do we best use our limited resources to effectively push for policy change? Anything you'd like to add to that, Lori?
Well, I want to just point out that those of you who are able to download the handout, you'll see much more detail here, and we'll email it to anybody who doesn't have it. It's available on our website too, so don't worry if for some reason you weren't able to get it. But I wanted to show how these things are embedded. If you go back to the slide, Messages Never First, what you see here are general questions, the way that you might ask them of yourself. What do we want to change in the world? How are we going to change it? And why does it matter? And we're going to get to that third question in just a second, because we're going to talk about framing and what that means. And that's where the why does it matter comes in. But the anchor here is, you'll notice, not media, but the place that and thing in the world that you want to change. So the layers of strategy, the next slide, are the specifics about that, because there are certain questions that you ask of each set. And then the next slide, the developing strategies, are some specifics to help you figure out how you're going to get to that spot. What's the problem? What's the solution? Questions that you have to have answers to and that you have to balance in the right way. So when you're figuring out what you want to change in the world, you have to know the specifics about the problem or issue and the details about the solution or policy. You also have to know who has their finger on the button that can make the change you want. Is it the president of the school board, like Julieta says? Is it some other entity on the city council, or is it the CEO of an institution that you're trying to change? Very often people think of who has the power to make the change in general terms, like the community really has to come together. That's not what we're talking about here. Our target here is very, very narrow. Sometimes it's one person. Sometimes it's a couple of votes. And that's another distinction between media advocacy and social marketing or other information campaigns, where the target is the general public. You want everybody to know about how to prevent violence. But in this instance, when you're trying to affect a specific policy change, your target is much narrower. Then you go to the next, which is how to apply pressure to that target, and that gets to what Julieta was talking about, who's joining you in this problem definition and in the solution you're seeking, and those are the people that can be mobilized to apply the pressure. And then we get to the question of what do the targets need to hear, and that brings us to framing. Now the thing about framing, and you're going to see a scale here, and this scale that you see is out of balance. And the reason it's out of balance is because it's representing a media context for how people are going to hear messages. The idea is that people don't come as a blank slate. There's no such thing as a blank slate of ideas. It means that whatever we say as advocates, whatever you're putting forth in the media campaign that you're working on now, is going to be heard against several backdrops. One of those backdrops is the media context, so we're going to talk about that. The other backdrop is that people come with ideas in their heads, and those ideas shape what they hear. And sometimes they dismiss what they hear based on what's in their heads. Sometimes they connect to what they hear based on what's in their heads. And so that's what we want to talk about a little bit. And that scale that we're representing here is out of balance in a very particular way. And so I'm going to explain what that means and what that means in relation to violence. And if I rattle on too long, Julieta will stop me, right, Julieta? Okay. She's saying yes. You can't see her, but she's nodding her head. Okay. So here's the deal with the scale. There's two things being weighed here: institutional accountability and personal responsibility. And what you can see from the scale is that personal responsibility outweighs institutional accountability. What this is a representation of is the research on how social issues, including violence, appear in the news. When you study the news, if you take each news article, no matter what topic you're researching, and you ask that, if you ask of that article, if you will, one question, you say, how is responsibility for the problem or solution portrayed in this article? You'll find two things at the end of your research. The first thing you'll find is that you will have two piles. You will find articles that place responsibility at the foot of individuals, and you will have articles that place responsibility at the foot of institutions, government, or larger systems. So that's thing number one. The second thing you will find, and this is a robust, consistent finding across all kinds of issues, the second thing you'll find is that the number of stories that place personal responsibility at the foot of individuals greatly outnumber the number of stories that put responsibility in some kind of shared context between individuals and institutions or at the foot of government or other sorts of organizations. Now, this is extremely problematic for those of us in public health and for those of us concerned about violence against women or any other kind of violence, because what the research shows is that when individuals see stories, read stories, or see them on television, most of this research comes from television, when they see stories on television that put the focus of the story very narrowly so that it is highlighting an event or a person, so that it's framed tightly, what I would say, around a portrait, as opposed to embedding a portrait of somebody in some kind of larger landscape. When people see stories like that, and about 80% of news looks like that, then in research settings are asked to say what the responsibility is for solving that problem portrayed in the story, audiences will answer in ways that tend to blame the victim. So when people see typical news stories that focus on events or people, and then are asked, what should we do about the problem, sort of regardless of what was portrayed specifically in the story, they will answer the question, what should we do about this, in ways that put the responsibility or onus for fixing the problem back on the person. It's like they can't see the system or what the person is embedded in, whether that's an economic system, a social system, an educational system. It's just out of view when the news story focuses in on the person. That's even when it's a great story about the person. It's even when it's a hero story. Somebody's done something magnificent. Then the takeaway message becomes, wow, people can overcome anything, and you don't have to think about what to do about the system. That's the bad news for us. That's why the scale is out of balance. The good news is that when stories include that person or event in some larger context, so when stories place a portrait into a landscape and show us just a little bit about the landscape, we're not talking 60 minutes here. We're talking a minute 20 news story on television, same for both sides of the scale here. And in that minute 20, if there's some connection to a larger context, whatever it is, then in research settings, when audiences have been shown stories like that embedded in news broadcasts and said, how do we solve this problem, then audiences answer in ways that include government or institutions as part of the problem or part of the solution. And generally speaking, regardless of what the policy of the moment is, generally speaking, in public health, that's what we're seeking. We're looking for government and institutions to take responsibility too. It's not that we're excluding personal responsibility. We need lots of it, and people need to be responsible for their actions, absolutely. But we have to have a shared responsibility so that the society we're creating, the institutions we're putting in place, and the rules that we agree upon foster health and safe environments, healthy and safe environments. And that requires a little bit different focus, not a hugely different focus, but at least a little bit different focus. And this scale and this understanding of the societal portrayals through the news media are what underlie a lot of the advice we have for how people talk about this issue. And then as the issue is framed, it goes back to the layers of strategy that Julieta talked about. So we're going to knit those things together as we get to the end of the webinar. But we have to understand that as we talk to reporters and as we talk to others in the field and others outside of the field in particular, their starting point is going to be influenced by a media environment that repeats over and over again, about 80% of the time, stories in a way that point to individual personal responsibility, individual accountability, rather than institutional. So that means if we have something else in mind, if we have some institutional accountability in mind, then we have to know how to articulate it. We have to be able to describe it, both in ways reporters can write it down and report on it, and in ways that policymakers can understand. We can't assume that people understand what those systems are or what we want to change about those systems. And for violence, it's particularly difficult because of our tendency to blame the victim. And I'm going to show you the next slide, which is a quotation from a story that Eric Schlosser did in the Atlantic Monthly, which was about a homicide and an instance where the perpetrator got off. But the reason I want to show you this quotation, I'm going to read it to you, is because it really helps explain why, with violence in particular, our general tendency to focus on individuals is exacerbated and makes the situation even more difficult. So here's how Eric Schlosser is explaining in the Atlantic Monthly story what happened, or the impact of it. He's saying, people distance themselves from such tragedy. One way is to assume that the victim was somehow responsible for his or her own death. Blaming the victim has a strong intrinsic appeal. It preserves the illusion that the world is rational and just, that things happen for a reason. It sustains the American belief that a person can control his or her destiny. And it gets everybody else, at times even the murderer, off the hook. If the victim is somehow to blame, according to this logic, then the rest of us are safe. So this is a mechanism, a self-protective mechanism in some ways, that we are up against when it comes to how portrayals of violence are interpreted and in terms of how we make the case for what we're trying to do. And I'm going to tell you what the conclusions of some of our research have been on violence, and you can download our studies. We'll be sure you have the URL at the end to do that. And they'll give you a little bit of insight into this, how it applies to intimate partner violence and in child sexual assault. So I'm just going to tell you what these two slides are about, and then we'll talk about how to put these two things together, how to put the developing strategy and layers of strategy idea about what you want to change in the world together with the starting point of how people are coming to incidents of violence, and then we'll talk together in our last 30 minutes about planning things. So what you see here are the covers of two of our studies. On the left is issue 13. The title of that study is called Distracted by Drama. Pardon me. It's the it's the analysis of intimate partner violence reporting in two very high-quality newspapers, the Los Angeles Times and the San Jose Mercury News, compared to how those same newspapers covered other types of violence. And there's two things we examined in that study. One is the comparison of intimate partner violence with other types of violence. And then the other thing we did was look carefully at the blaming the victim idea, because we know how prominent that is and what a concern it is for advocates who are trying to prevent intimate partner violence. The conclusion of the study for the comparison of intimate partner violence to other types of violence is this. In violence reporting in general, in newspapers of all kinds, and this is, again, a very robust finding across a century, believe it or not, of studies of violence in the news. The earliest study we found was 1910, I think. It was either 1910 or 1901. I might be transposing my numbers, but it was about a century of news. And the key consistent finding is that when violence is covered in the newspaper, it is usually of the most extreme kind. meaning that in small communities in particular, almost all of the homicides are covered. Occasionally, some of the aggravated assaults are covered. Almost no rapes are covered. And that is consistent across all types of news. So in some ways, what you have in newspapers when it comes to violence reporting is an exaggeration, which is a funny word to use in this context because we absolutely need a media spotlight on violence. The community has to know what's going on about itself if it wants to prevent things from happening in the future. So it's an odd way to put it. I just haven't really figured out a better way to put it. But what the conclusion is that you see things out of balance, so that the community is not getting reflected back to itself really the range of the types of violence, particularly since there's far more aggravated assault and other kinds of domestic violence than there is homicide. And in many communities, especially smaller communities, domestic violence is the number one call to police. So that's generally speaking not reflected. So that's problem number one. The other thing we found is that same kind of emphasis on the most extreme forms of violence in coverage about violence generally is even worse when it comes to intimate partner violence. What we found is that depending on the newspaper, we found 3 to 10 times higher emphasis on the extreme cases of intimate partner violence, the kinds of things that you've seen in the headlines that you are all too familiar with, where you have a murder-suicide or you have something that is way out of the ordinary, despite the fact that it happens way too much, if you'll kind of hold both those thoughts in your head at once. Again, what this means is that we don't have reflected back to us as a community the things that are happening regularly, the things that could be intervened at earlier, the things that we want to address as a society. We don't know really that we need to do that because we don't see it in a general sense in terms of how the news media portray ourselves back to ourselves. The other thing we looked at in that study on the left on intimate partner violence was whether the language of the descriptions blamed the victim, because that's what the literature said we would find, and we were surprised that, in fact, we didn't really find it. And partly this may be because we were looking at two very high-quality newspapers, Los Angeles Times, San Jose Mercury News. I was always our finding I'm confident about. I know that's what we saw. It is at odds with what other people have found, so I've always wondered about it. And one of the things I've begun to think about lately is that when we studied it, we didn't study how the perpetrator was portrayed. So it may well be that in those studies that the perpetrator was portrayed with the kind of humanizing details that allow you to think of them as an exception or a person or an otherwise good guy, you know, the kinds of stories I mean. But because of confidentiality and because of the legal process and maybe just because of bias, you don't get those same kinds of details about the victim. So even though the victim isn't blamed, the victim's also not humanized. So I think there's still a distinction between those things, and this isn't a finding, this is really more a question I have because it's something that we didn't look at, but it's something that I've been thinking about a lot as we've continued to study this issue over the years. So the basic takeaway from the first study is that the only things that appear in the news around intimate partner violence are the most extreme. And if we need to have people understand a continuum of violence here, if we're going to do something about it, we need to do something to make that newsworthy and to make people understand and see it, not necessarily on a case-by-case basis, because really the goal here, as we'll find, is to create news around these issues when they're not associated with a particular incident of violence. So we'll get to that. The study on the right we issued last May, this is called Case by Case, Child Sexual Abuse in the News. And it's, as you know, is a topic of lots of media coverage right now because of what's going on at Penn State. I can tell you that when we looked at the study that we did, we wanted to see, once again, how is the issue of child sexual abuse routinely covered in the news? So we looked at 3 years of news coverage from 2007 through 2009, but we explicitly excluded the Catholic Church scandals because we wanted to keep that at the side so we can see when it's not a big institution, what happens to routine coverage generally. So there's a couple of conclusions from this study that are relevant that I think apply to violence in general, but particularly to child sexual abuse. The first is that it's rarely in the news. There's only about a story a week across the nation about the kind of news that's not associated with a big institution like the Catholic Church or the Boy Scouts or, in recent days, Penn State. So that's an invisibility issue that we have to deal with. The second thing is that when stories do come up, they are by and large associated with some milestone on the criminal justice law enforcement process. So an arrest, first an allegation, then an arrest, then something that happens in the court, maybe a sentencing, or so it's at those moments when a trial and then sentencing, it's at those moments when we see news. So most of the news about child sexual abuse is associated with the criminal justice system. I think a fair amount of it with intimate partner violence is as well. What that means is that, and why that's problematic for primary prevention purposes, is that we're hearing about something after the fact. And the ideas about what to do are then more on the criminal justice side, which is about punishing the perpetrator, which absolutely has to happen, and we have to see news about it. But what it means is that we have a gaping hole in terms of prevention. And once again, if we want to create news that helps people understand what prevention means in this context, or what systems and structures need to change in order to protect children, women, families from violence, we have to be able to create news that is not associated with a particular incident of violence, because that's where we can open up the conversation a little bit. Once the violence has happened, we still have to have a conversation about it, but it's going to be focused on that having happened. The second takeaway from from issue 19, the child sexual abuse study, is that the language that is used to describe child sexual abuse is very vague. We're seeing some differences now in the Penn State coverage, which I find encouraging, and actually we hope to do a more detailed study about what's going on right now, if we can. But what we found in the general coverage that in the study we released last summer is that because the language is vague, people don't really know what had happened and what happened, and so we're wondering if it's going to be more important in this type of violence to have a more specific and precise description of the kind of violence that's going on. So that's what we have learned from the coverage, and that we want to apply to what we see in the news and what we want to plan for in the news. And so we want to take this now to that idea of planning. And how are we doing for time here, Julieta?
About 12 minutes of slide presentation. We're doing well. We're in a great place to start talking about what people can do and how people can start getting attention and actually creating news.
Right. So let's see the next slide. And so where we've come so far, just to summarize where we've been, we started with, this is going to be about more than a message. You have to know first what you want to change in the world and how you're going to change it. Then we have to understand that whatever we say about it is going to be heard against a backdrop that is about a backdrop that has been dominated by ideas about personal responsibility. That's where the values come in. So remember I said when we were looking at that slide, more than a message, that the third question, why does it matter? This becomes very important because we want to be sure that we're saying that a healthy and safe environment for all children and families and women and whoever we're concerned about is extremely important and worth our resources and worth our attention and worth changing policy. So we have to articulate that out loud. And then we have to do it in a way that gets some attention so it becomes part of our national conversation or our community conversation. And as Russell Chandra, a tobacco control advocate, says, to gain the media's attention, you can't just say something, you have to do something. So the question is, what are you going to do? Now, one way you can start to think about these things is you can think every time there's a story on what? It should include information about what? So if you're thinking about this from a perspective like we usually do, like when there's an incident of violence, every time there's a story on domestic violence, it should include information about, you might say, prevention, but that needs to be specified. What about prevention? And then you could flip it. Every time there's a story about education, it should include information about domestic violence. Every time there's a story about the police department, it should include. Or every time there's a story about what system are you trying to affect or change. If you start to think about these categories and where you want to see stories about intimate partner violence show up, you can start to look at the newspaper a little bit differently and think about where should these stories start to appear. So that's just kind of a general thing you can play with and see if it helps. And then there are really a finite list of specific tactics that you can use. The first two tactics are the general ones that go on all the time. Community organizing and policy development is the first one. Julieta referred to those right at the beginning. Who are you engaging in your fight? Who are you working with to be sure? I shouldn't be using the word fight, right? I can just hear my violence prevention friends telling me to excise that from my language. Who are you engaged with in your advocacy? Who are you working with to do that community organizing, to come together at whatever institution or government meeting to say we want to change something and here's what we want to change and here's how we want to change it. So all that stuff has to be done up front. That's the community organizing and policy development. You want the anchor of your work to be the change you're seeking in the world. The anchor of your work is not your media advocacy, that you don't want your media tail to wag your policy dog. You want your policy dog to go right forward, know what it wants to do, and then you want the media to amplify and accelerate that progress on the policy front. The second thing you want to do is monitor the media and develop a press list. Monitoring the media can take all kinds of forms. The studies I just talked about were one way, and of course we do that, for a living over here, so we're in-depth engaged. We hire researchers, we delve in deep. You might want to do that too. You might want to draw on other people like us and others who study the news, or you might just want to do something a little bit more specific in your locale. Who's writing the stories that you think are important? Who's writing the education stories that you want to know about your organization and know about your policies? Who's writing the sports stories that you want to get to know? It doesn't have to be every reporter in the city or at the newspaper. It could be just a couple of reporters. What are they writing about, and why do you think they would be good to get to know? Get to know them ahead of time. Develop that press list, establish the relationships so that when your email comes through, they know your name before something happens. That's going to be very, very, very important. If you talk to reporters, that's always what they'll tell you. So those two first items on the list are the ongoing things. Then the last four items are the different tactics you might choose at different times. Use editorial pages. That's a responsive way to approach the news when you send in a letter to the editor. It can also be proactive if you have an op-ed that's commenting on news or telling about something that's coming up, and you can visit editorial boards. Go talk to the editors at the paper and say, we want you to write an editorial on this, and here's why. And they're going to ask you some hard questions about it. Come with a couple of your coalition members. Be prepared to answer those questions, and that editorial can go a long way as the voice of the paper saying what, as a community, it thinks should be done to prevent violence. Creating news is the best way for you to have a public conversation on your own terms. So to create news, there's lots of things that you can do that just bring attention, bring the spotlight at a time that you choose. And we're going to give you some examples of how to do that or some ways to think about that. There are some basic things that people in public health do to create news. One is put out a report. Or issue a demand. Maybe there's somebody you've been negotiating with, and it's time now to call them out and say, look, we've been talking to this person for a year now. Here's what they said they wanted to do. Why haven't they done it yet? You might, Occupy Wall Street has certainly created news and changed a public conversation. You don't have to take to the streets to do it, but that's certainly one way. So creating news can be very creative, and you can find ways to insert something into the news spotlight if you think about what constitutes news, what's controversial, what's a justice issue, what affects children, what's a local angle, and we'll get what's an anniversary or a milestone. So we'll talk about that in just a second. Using breaking news is taking advantage of headlines right now to connect and then pivot to your issue. So you might take something that's been a headline, like Penn State, and say what's been going on in your local community, how you're thinking about it, what it means for violence prevention in general. That would be a perfect way to connect for an op-ed, for example, in a local paper to maybe help your local community and your local policymakers know that there are resources in the community, that you've been thinking about it, or that these tough questions require more public debate and decision and discussion. Then, of course, if you want to really control the message, you can take out an ad and pay for advertising, which can be a very useful thing to do. So when you're anticipating and planning your media advocacy, you want to know, who are you planning for? Is this for your organization, your whole coalition? Is this one campaign? Is this an ongoing thing? Is it short-term? Is it long-term? You need to start to lay out the parameters. What time frame does it cover? Are you planning for one single event, or are you going to go on for a longer-term goal and make a longer-term plan? And how will you capture your plan? Are you just going to sit around and talk it through? Are you going to write something formally? Who do you have to share it with? So you don't want to write a big tome for a media advocacy plan and put it up on a shelf. You want to have something that's living, useful, that people can use together. And then as you do that, be concrete. Think about the calendar. There are stories every January about drinking and driving related to New Year's. There are stories every February about Valentine's Day. Once the Heart Association kind of hijacked that holiday and said, Valentine's Day is about hearts, let's talk about heart health. What are the stories that you'll see in March, in April, in May? Somebody in the chat already talked about Domestic Violence Awareness Month and those sorts of things, which have been created for the express purpose of taking advantage of the calendar like this. But be more creative than that. Think about the stories that are going to come up anyway. Is there an angle for your story? What's Thanksgiving dinner at a shelter like? What's the December story that's coming up? What kind of presents do you want the community to give itself to end violence against women? Or whatever the issue is. That sounds a little silly, I know, but if you start thinking about the calendar, reporters are tired of getting assigned the same stories over and over again. If you can think of a way for them to tell an old story in a new way, they're going to be very interested. Also think about the key policy moments. That's not going to happen all year long, but when it happens, that's going to be a very important time for actual hard news that you can deliver to the reporters to focus them on something that's going to happen. If there's an advocacy action that you're taking to support that key policy moment, is there something newsworthy about that? What are the news hooks that you can pull out of there and tell a reporter about? They're not going to know about it unless you tell them. And then that can help you find some media actions to take that will help you make the case in a public way so that the conversation you're having privately with policymakers becomes of import to the whole community. And then we're going to skip this slide just in the interest of time, and it brings us back to the question that we asked you at the very beginning. And what we'd like to do is open up the telephones so that you can now have a discussion with us, voice your questions about anything you've heard so far in the webinar or anything that you haven't heard that you'd like to bring up. And the hope was that we could generate some ideas together about how you might create news about primary prevention of intimate partner violence that's not related to a specific incident of violence. So you're not trapped in that criminal justice frame, but instead can start a conversation about prevention. So I'm going to ask Heather to unmute the lines.
So what we're going to do is we're going to have people raise their hands. So you'll see there's a little bar.
Yes, don't listen to me at all.
Thanks, Lori. So under your attendees, there's a little bar that has 3 little icons. One looks like a hand, another one looks like bar graphs, another one looks like a microphone with a line through it. So we want everyone who has something they want to share to click on the little hand, and that means that we're going to put you in a queue, and that queue we're going to sort through and call on your name and then have some actual phone participation. If you prefer to participate via chat, that's fine too. I can read chat questions, but we want to first get to back to this question of what can you do to create news about primary prevention of IPV that is not related to a specific incident of violence. And I'm going to give folks a little bit of time to start raising their hands. And I'm also going to just take a few moments to read some of the great ideas that we had earlier on in this conversation. People have had to think creatively about this because it is a struggle to keep your issue in the news in a way that's really going to be effective to further your goals. So we had Maggie Reeves write that people should write opinion pieces. Tammy L. wrote that promoting a new program getting launched is a great way to create news. We also had a few ideas related to op-eds related to highlighting upcoming prevention trainings with community partners. So using that opportunity to also bring up and lift up those community partnerships. Some other folks also mentioned using national reports or statistics and localizing them. So that's also a really, really great, important way to create news. And we want to also underline that people have pointed to the creating data itself, because something that we want to, as Lori said, creating news can definitely be as simple as taking information that's already there, that already exists, and localizing it and making it specific to your issue. So someone else had the note that use the opportunity to pitch education programs. So specifically go to the education reporter and they're maybe probably not used to talking about domestic violence. It's not an issue that crosses their desk often, but it is a great way to tell the story in a way that puts prevention first. So as Lori was saying, as a radio producer, I used to have to produce 2 hours of radio content Monday through Friday, and it was rough, especially when we would get to these issues, seasonal links and hooks where you knew you had to talk, kids are back in school, you had to tell back-to-school stories. I don't want to tell the same back-to-school story. Well, wouldn't that be a great opportunity to talk about domestic violence or teen dating violence curriculum? Because that's something I never did in all my years as a radio producer, and it's a great way to do that. So we have Jeff M. He used the opportunity of using movie premieres to engage audiences, and that's definitely something that Twilight, people are definitely talking about Twilight. Seems like everyone's talking about Twilight, so what a great way to talk about healthy teen dating relationships. That's a great idea. Also, he has a great idea around sports editors and using that as an opportunity to move the conversation to prevention, talking about coaching boys into men playbooks. Those are some great, great ideas that we really want to point people to. So feel free to keep popping in those questions, either through chat and to raise your hand as soon as, whenever the mood strikes and you think of any ideas. We're now going to open up the conversation to more questions, and I'll just ask a question to you, Lori, that came up earlier in our conversation. We had a participant ask if the research has been divided around race or has been separated out by race, and if you seen any differences when that is accounted for?
There is research that distinguishes between people's reaction to news stories depending on the race of the people portrayed. It's not specific to violence as far as, well, let me put it this way. It's not specific to intimate partner violence or to child abuse. Where it's come up is in different kinds of studies about crime and violence or in studies in general. So, for example, when we showed you the scale before and talked about the fact that personal responsibility stories are more dominant in the news than the institutional accountability stories, I was talking about research that showed how when people saw those stories that focused on the landscape, that had the event or person embedded in some kind of larger context, they interpreted the stories in ways that helped them see that systems, government, institutions could be part of the solution along with individuals, not just one or the other. So that's a very that's an important it's a finding that's been really important to me and in our work at BMSG, because it has helped us understand how to help people structure stories so that the landscape is part of what's included. However, when that research was done showing people in the story who were people of color, particularly African Americans, the effect went away. So what that means is that even when the story was more thematic, more a landscape story, where a person was embedded in that larger context, if that person was African American, the audience still blamed the victim. A huge problem. The other set of research that has focused on race has been around crime and violence, and what that shows is that the depictions over time of crime stories in some instances have focused on people of color being the perpetrators. That there's some research that shows that, and the flip side is also true, which is that people of color are underrepresented in some studies as the victims of violence. So you see an emphasis on white victims and on people of color who are perpetrators. That's also problematic over time. And then there's one other aspect to this, Julieta, that sometimes gets lost, because when researchers study news of coverage of violence, in general, they're studying crime and violence stories. They're not looking at the whole background. They're not looking at the whole newspaper and saying, well, what's in here in general? And this is particularly of concern when you think about how young people in our society are portrayed, particularly young men, because in general, young people just don't show up in the paper very much. When they do, they show up in education stories and they show up in violence stories. And the problem there is that you end up with a huge distortion, because almost no kids are involved in violence, and yet almost every kid is involved in education in some way. So you see a distortion that equalizes those two things when in fact it is quite out of balance. And so we've got some studies like that on our website as well. What we're going to do now, because we haven't had people raise their hands and we don't really know if that's a technical problem or not, we are going to unmute all the phone lines. Now, this could get noisy. If it does, we'll ask you to mute. But it is also an opportunity just to have a conversation, if possible, a conversation with 50 or so people in the dark. And so the unmuting is going to happen right now. And so if you have a question, just say so. And please say your name and where you are. We'll do our best to moderate. Anybody have a question?
Yes. Okay, I have it.
Okay, say who you are and what your question is. The dog has a question, but unfortunately we don't speak dog. But I thought I heard somebody say they did have a question. Was that right?
I think that we'll definitely have these lines unmuted, so just feel free. We're gonna there'll be one more second. I just realized that the question I asked you, Lori, was a little incomplete. The initial person who asked about if the findings were any different when accounting and looking at different racial or ethnic groups. The person also asked about class and whether or not that has ever been studied, and if when news coverage focuses on crime impacting wealthier communities, if that's different when it's focused on low-income communities. But you kind of touched on that in your question.
Yeah, most of the studies I know that touch on class and portrayals in the media have been about poverty and not about violence per se. So there may be, and it may be that we're just not familiar with them. It's something that certainly the group could share with Delta Prep, send those kinds of things to Pam, and I know that she'd probably find a way to share them with the group.
So we're going to allow for a little bit of awkward silence for folks to jump in and share their questions, because I think that this is a great opportunity to hear also about some of the wonderful tools that you all are using. This group that we have with us, of 50 or so people, have been doing a lot of hard thinking about this, and you really understand the issue and also understand how it really is a very different story to tell primary prevention intimate partner violence stories as opposed to stories around emergency services and shelters and stories where you can show someone who's a survivor. I think that as a radio person, people oftentimes don't think, in general, in our society, don't think of primary prevention of intimate partner violence. Oftentimes think violence is just, we'll always have violence in this world. There's nothing you can really do about it. It's just a matter of helping people once they've been impacted by violence. And as Lori's pointed to, a lot of this research has also pointed to stranger danger type, the emphasis being put on people outside of close family and friends being perpetrators of things in situations like child sexual assault. What ways have you found as a group that you've been able to actually turn the conversation to primary prevention? So not after the fact, once we have people who have been impacted, but before this actually comes to be the case. So some of the solutions like we've been seeing, like education, instituting education, and different solutions related to getting to the root causes of violence.
This is the awkward. You're supposed to fill it in.
If not, we have some great ideas around that have been produced by this group that would be really useful to share with you all. For example, when looking at something like passing legislation to change curriculum, so changing policies at a school board or at a statewide level around teen fighting violence curriculum, or around incorporating education around healthy relationships at a young age for young people, there was the idea of creating maps to show what communities already have this in place and what communities don't, to really highlight, well, there are gaps, and this is something that isn't revolutionary, and there are a lot of communities that are pioneers and doing great work and changing the way young people are taught about relationships, and that in turn has really made a difference. And it's a lot harder to tell a story about the violence that hasn't happened yet than the violence that has, but that's really our job if we are going to move the needle so people are thinking about preventing violence before it happens. If we don't have any more questions, we have some lessons learned that we'd love to share with you all to give a bigger picture of to kind of wrap up some of these thoughts that we've been covering in this session.
Before we get to that, Julieta, let me ask one more question, just in case somebody's dying to speak, and that would be, when we started out, the first poll question that we asked you inquired as to how comfortable you felt doing different kinds of going out front with media on this issue. And you all, for the most part, felt somewhat comfortable. So here's my question. What would make you feel more comfortable? What is it that you need? Is it training? Is it more relationships with reporters? Is it more solid policy goals? Is there something that you wished you had? Maybe it's a person who could focus on this. I'm just curious, what would it take for you to feel highly confident about attracting news attention to this issue?
We've heard from Christina B. that for her, she feels that more relationships with media producers would really help that comfort level. And that's definitely something that we point to time and time again, because there is an education process that really does have to happen with media producers. And that's something that we, as someone who was a radio producer, my heart was in the right place. I wanted to tell good stories, but I can point to a lot of times where I missed the boat. And I missed the boat not because I'm an inherently bad person, but because we don't make those connections. And we're not, as a society, we don't generally look at primary prevention. So as a radio producer, as a media person, I had no more insight than the average person on the street onto what are the causes of violence and can violence be prevented. So those are the parts. You are all experts in that area. You do have ideas. You do have solutions. You know how violence can be prevented. So those are all things that need to be introduced, and any way that you can actually think about actually starting to present that information in a way that's compelling, it really is helpful. And so we've had a couple questions actually related to how do you suggest making contact with media producers and how do you build relationships with media personnel? Well, I would really point to a few different areas. One is what Lori already went over when it came to general tactics, and that is monitoring the news. To really first get to building those relationships, you first have to understand the landscape, the media landscape, and see who's writing stories at all that could overlap or intersect around your policy goals.
Right, and then you're absolutely right, Christina. Cold calling, yes. Letters, yes. Visits, yes. Delivering info packets, yes. But then to whom? So Julieta is saying figure out who the right person is to do that, and then absolutely make a call and take somebody for coffee or lunch just to introduce yourself. They're really eager to do that. And, I have reporters come to my class at the university all the time, every year, and they say the same thing. We always say, what's the best way for these students, once they're out in the real world, to meet you, to tell you about a news event? And the reporters say, well, don't wait until the news event. Come first. Reporters are eager. Reporters get into that business because they're curious people. They like to talk to people, and they want to meet you and find out stories. They have to what they call feed the beast. And Heather is chomping at the bit to draw on her journalism background to give you a tip as well.
Yeah, I just wanted to add to what Lori's already saying about, the coffees and the lunches. And I'm actually a former reporter, and I always appreciated it when people took the time to kind of develop that relationship when they didn't immediately need something from me. A lot of being a journalist is, trying to assess how trustworthy a source is and building that relationship. And so if people are just making their first contact when there's a news event happening, there's not the same level of comfort that there is if you've already talked with that person over coffee or tea, you've gotten to know them, and then when that news event does happen or somebody wants to pitch a story, you're much more comfortable, and I was always way more receptive to it.
And Maggie makes a great point saying that it's helpful to write feedback about their articles, positive, with ideas for improvement. I can tell you a story about that. When we started working on the issue of food and obesity prevention, this is several years ago, the Chicago Trib did this amazing series on, it was called Obesity, the Oreo, and You. And it was really this fantastic series, believe it or not. And it went over several days, and I was really impressed. And so I sent an email to the 3 reporters who had done the series, and I just told them I had to let them know that this was an outstanding series and that I studied this stuff for a living, so I knew what I was talking about. And my phone rang in 15 minutes. The reporter talked to me. He said, thank you so much for that. They had, as it turns out, been getting a lot of flack for the series because the war in Iraq had just broken out and people wanted to know why they were writing about cookies. And this is, of course, an important issue. So you never know, just a friendly little note that says, wow, so glad you covered this. And, of course, telling them something that you appreciated about the story. I wouldn't use the terms good and bad with a reporter, because it's not their job to write good or bad stories. It's their job to cover things accurately and fairly. So if they have done something well, let them know. If there's an angle on the story that they might not know about, let them know about that as well. And that's a great way to make some inroads.
So it looks like we have someone raising their hand. We have Fern, who has a question for us. Thank you so much for breaking the webinar ice for us. So, Fern, thank you so much. What is your question for us?
And actually, this is Lorian Castell, who's sitting here with Fern in Pennsylvania. And don't worry, we don't want to talk about the Penn State issue.
Okay.
That would take all our time. But I just wanted to share a strategy that we're using here in Pennsylvania that we're really excited about, which is to engage young journalists and sort of engage them in the topic of teen dating violence prevention and nurture their activism. There's a statewide group representing school newspapers, and they all came together for a statewide meeting, and we talked to them about teen dating violence prevention and invited them to our spring conference to learn more. We're sort of, the carrot is scholarships and iTunes cards and that sort of thing. But we really think about, nurturing the journalists of the future to care about this issue.
That's a really great way, Lori, to get to the bigger issue of how do you reach a large group of people who maybe this isn't on their radar at all, and that could be something that for years to come is now a light bulb that's been turned on. So that's a really wonderful tip to share of building those. And also, especially if you are working with young journalists, that's a great way to talk about teen dating violence curriculum, because that's definitely, I'm sure that they're having to cover curriculum changes, and it's something that's a lot more compelling to hear from youth around that issue. Thank you. So we also have Tori. We also have Tori L. On the line with us. Tori, thank you so much for asking your question. What would you like to share with the group?
Well, actually I had more of a question about something that you guys spoke about moments ago, which was sort of introducing yourself to journalists before the news happens. And in addition to responding to articles, were there some other suggestions that you have for those of us who are advocating with the media to sort of introduce ourselves to?
Yes, thank you. And actually, we had someone else that had that question as well. So thank you so much, Tori, for asking that. So as a radio producer, honestly, I would have to say that even though it would be lovely to go to coffee or lunch, in my years as a full-time radio producer, was not ever able to do that just because of my crunch. I know, so I want to definitely just put that out there, not to dissuade people who feel that they don't get that warm response, because it definitely depends on your media market. If you're in a smaller town, if you have a smaller media market, there is more of a community sense where you have reporters that have less on their plate and can take that time. But I would recommend for people that from either small or large media markets, for them to also really present themselves as available experts and build the relationship as someone that the journalist can go to when they have questions about the issue. Because I would say that 99% of the people that would leave me voicemails or send me emails, were communications people that their job was to promote a product, an event that wasn't public health or nonprofit related at all. It was really a new, this will help you lose weight fast. It will, this great new program and exercise, and it'll be great. And so you have a lot of people who are paid PR people that are bombarding journalists day in, day out. So for me, when I would occasionally get someone that would contact me that their level of expertise was perhaps they were a direct care provider. For example, let's say they worked providing care to women who were survivors of domestic violence, or if they were someone who was a policy expert and they worked lobbying around these issues. I could then have someone that I could go to on a story. If I needed a panel around what's happening, for example, right now in Penn State, and I wanted a perspective of people who could give me a bird's eye view of, well, what is child sexual assault? What is this? And how has it happened? Give me some context. They would be a source for me. So I would say becoming a source is incredibly, incredibly useful and effective. And that means touting not just your ability to send a press release or be the communications person, but say, you know what? This is my experience. I work at this organization. These are my skills. This is what I bring to the table. Because then you become a resource. And I can't tell you, if it weren't for my 4 or 5 very, very treasured contacts in every specific area that I can think of, whether it's someone who I could talk to about foreign policy or someone I can talk to about school lunch policy, those different areas, if I didn't have those experts to say, well, am I off on this? Is this correct? Who do I go to for this kind of data? If I didn't have those people to email, I would be at a loss, because most journalists, we're not experts. We know a little bit about a lot of things, so we rely on our community experts. So if you could build that opportunity by sending an email and saying, well, you did this story about that. I really appreciate it. It looks like you're interested in this topic. Next time you're talking about teen dating violence, it may interest you to go to this website that has statistics around what different counties have in terms of information. Or you may appreciate this national spokesperson that is a great talker, and you could get some great quotes from. And every time someone has led me to more information, I have really valued it. So there are times where you may get a call and someone say, I need to talk to you about Penn State, and that may not be the best fit. But when you actually take the next step and refer that person to a great source, you are building a relationship, and it is incredibly useful to the reporter, and they remember that. They say, this is someone credible, this is someone who knows their stuff, and this is someone I can go back to, and they will. And but it is your job to send that reminder and to say, hey, remember me? Here's my email signature. You have my contact information. Here's even a cell phone. There were a lot of times where I would need to contact someone 4 p.m. West Coast time. I'm at a loss. If I haven't found my right person on domestic violence and I don't have their cell phone number, it looks like we're going to have to do another topic next morning. So sending that cell phone number really does make a difference as well.
And I want to just underline something that Julieta said, which is that one of the things that you might do in that context is send them to somebody else. Yes. So don't feel like you have to answer any question. Never make stuff up. Never guess. If you don't know, say you don't know. If you don't know but you can get them the information or point them to who does, tell them that. So always be forthright about that, and just find any excuse to get over that barrier of feeling intimidated by a reporter to just make the contact. It might just be sending a fact sheet or introducing yourself, and maybe you won't hear back. But if the reporter covers that topic, isn't interested in it, and something comes up later, they'll think, somebody contacted me about this, and they'll start searching their email and they'll find you. So even though it might not feel immediately fruitful, it's definitely worth reaching out. And once again, you're not reaching out to everybody in the paper. Be specific. If there's a blogger, if there's somebody at the television station, if there's somebody who in particular, maybe they haven't reported on it yet, but you think they'll be in a position to, go ahead and reach out to them.
So we just have a few more minutes left, and we want to definitely make sure to, if anyone has any questions, feel free to raise your hand or to type it in the chat box. But we want to make sure we get a chance to wrap up what we've discussed today and kind of close out some of the main points we've been covering, which will also give folks an opportunity. If you did have any questions around how we define media advocacy or our layers of strategy, now that folks have had an opportunity to look at the handout that spells out our different layers, starting with the overall strategy, feel free to type in any questions. But yes, we want to just take an opportunity to highlight some of the main points that we've covered today, which is really that generally we are all excited to talk to the media for the most part. People want to get their message out there, and what we want people to do is just take a step back before that point and think, to what end? Message is not the important part. We want to make sure that it is only effective and it is only useful to engage the media if it furthers your policy goal, and it's going to be something that is not just getting in the news, but it's actually furthering your goals. So we want to make sure that's something we underline. We also want to make sure people illustrate the landscape in general and talk about these big picture policy solutions, and that they connect values to their solutions. So there are a lot of ways to do this. Excuse me. It really depends on your specific primary prevention policy solutions that you all are looking at. So the wide range that is, that really will shape what you see as your goals.
We didn't spend a lot of time talking about the values issue, but it's extremely important, and it's really quite simple, in fact. It's not that you have to spend your whole time talking about your values. It's that you have to include them in the other things that you're talking about and not spend all your time on sort of the nitty-gritty details of policy, but saying why, as a community, it's important to put these things in place. And really, it's just a line or two, but it's an important line or two.
And so you're all going to get a thank you email for participating in this webinar, and that webinar will include that email will include links to our issue 13 and issue 19 that Lori explained some of our findings from. So we really want to take this opportunity to thank you all. You'll also receive a follow-up survey, so please take a moment when you receive that link to complete that survey, just so we know what areas what you'd like more of, and what perhaps was especially interesting, or what perhaps wasn't as clear. And we want to make sure that you all know that we're here and we're available, and we want you to use us as resources. Berkeley Media Studies Group just relaunched its website, and we hope that it's as user-friendly as ever, and you can type in the search engine information related to anything that related to anything that you find important. So we are at 11:30. We have I saw another question pop up, but we want to let people know that the slides can be available as well. So please definitely download if you're interested.
I think that's everything for the webinar, and I hope that you found this interesting. Please give Pam your feedback, and they're always interested in knowing what can help everybody in this field do a better job talking about primary prevention, putting this issue in front of the people who speak to the whole world, the news media, and make it an understandable and important and compelling issue so that we can promote the kinds of policies we need to see safer and healthier environments for everyone. Thanks very much for being part of today.